So the sclera should be clear. The conjunctiva should not be injected or red. Now let's just think about what we learned last week. We learned that there are actually two types of conjunctiva. The bulbar, which actually covers the orbit, and then you have the conjunctiva, the palpebral conjunctiva, which lines the eyelids, supra and infraocular. Now, to examine the cornea, you have to go to the side. So you're going to take a pen light or possibly your otoscope, and you're going to look through the cornea, and it should be clear in the anterior area. Now we go down to visual acuity. Now all of you should have Snellen charts. They're the little cards. I'm not going to make you do the 20-foot evaluation. We don't have time for that. If you don't have one, we have a little card, and if it's held 14 inches away from the person's eyes and read with glasses on, we know that the person's corrected vision is going to be the equivalent of the 20/20. So the 14/14 with correction is going to be basically normal vision. Now it tells you based on how many you get right in each line. So we're going to actually have to do that hands-on. Now the next thing is the cover test. A cover test is to see if you have any strabismus. Now you all have seen children, or maybe adults, that have one eye deviated and it's kind of stuck there. So there are two types of strabismus. There's fixed strabismus where the eye stays put in this deviated position and it doesn't move from it. And then there's what we would call a non-fixed strabismus, and that's what we call lazy eye. Now let's see if this makes sense to you. If we cover one eye, my left eye doesn't have a job to do, right? Now if I had permanent or fixed strabismus, you could tell one eye would be up here or out there. But how do you tease out lazy eye? You take its job away by covering it, and it starts to wander around. It's on vacation. It doesn't have a job to do. Now it's probably looking off there someplace, and as soon as you uncover the eye, if the person has lazy eye, the eye is going to go, oh, time to go back to work, and it's going to look in the same direction as the other good